This is a huge achievement for UF Health. The cardiovascular program just became one of 24 facilities in Florida to receive a top accreditation. And it comes after a very rigorous 2-year process where it proved to provide top care for patients. And joining me now to explain exactly what this means from the hospital is Dr. Joseph Sabato. Dr. Sabato, good morning. So let's kind of start off with the difference in a heart attack versus cardiac arrest, and we'll kind of work our way through the rest of this.
Well, a heart attack is when someone has a blockage to part of the muscle of the heart.
Okay.
And that leads usually to chest pain. And then on occasion, about half the time, it can lead to someone actually having their heart stop. And that's what a cardiac arrest is.
So for patients experiencing either of these, how does this new designation help them? What does this mean for the future?
For patients that are suffering a heart attack, what it makes a difference is that we've built a system over the years working with rescue and working throughout the hospital between the emergency department and cardiology. Time is of the essence.
Okay.
When someone has chest pain and starts having a heart attack. All studies show that if you can treat that within 90 minutes, you can really limit the damage.
90 minutes.
90
That's
minutes.
the time frame. Okay.
Only half of people call rescue when they are actually having a heart attack.
Really?
The other half transport themselves to the hospital. So one of the key things is by calling rescue, you shorten the time to being able to make that intervention and save more heart muscle.
So when going over this designation, what does that mean, like, once you're actually in the hospital?
In the hospital, the systems are that we're able to get somebody up to the catheterization lab within a matter of minutes. And that makes all the difference in how quickly you can open that blockage and save that heart muscle. And this designation reaffirms all the processes we put in place, how our quality systems have improved that patient care. The other part of it is, and we are the only hospital in Florida designated to be able to be a resuscitation center. And that is those patients whose heart actually stops. We have the processes in place that didn't exist 15 years ago. They're able to have those people have the best possible outcome.
Wow. And, you know, there's also the back end, and I'm not exactly sure what the hospital's role or how this will affect that. But, you know, for patients who have suffered a heart attack or cardiac arrest, you know, there's a lot that has to happen during the recovery process. Can you talk about that?
That's right. 15 years ago, we didn't really understand the physiology of when someone's heart stopped and what we could do to make it, what made a difference with that. And then we found that by controlling their temperature, controlling their blood pressure, controlling the oxygen, and monitoring their brain, those factors could make a huge difference in recovery.
Wow.
And this designation affirms that we've installed those processes to be able to deal with that.
Dr. Sabato, thank you very much for taking time to speak with us about this and, you know, letting the public know what this means. And speaking of heart health, we have everything that you need to know about keeping yours in top shape. Just check out the Take It to Heart section under the Health tab on news4jax.com.